Hello, this is Dysmorphology and Teratogenic genetic tutorial presented by the SchrDbb with reference ABC of Clinical Genetics by Helen Kingston. So here we're going to visualize dysmorphology and teratogenesis. So in the introduction, you're going to see a dysmorphic facial feature with several developmental delay in a child with deletion of chromosome 1. So this is an example here. So to start with this tutorial, we're going to start with definition of certain terms. So we have the first term, which is malformation. So what is a malformation? A malformation is a primary structural defect occurring during the development of an organ or tissue. So let me explain. So when we talk about a malformation, is an abnormal development of a structure. So the structure has developed, but it has developed abnormally. So it's said to be malformed. So when we say congenital malformation, it means abnormal development of a structure. Example of a malformation can be seen here, where you can see exophthalmos or exomphalos, not exophthalmos, exomphalos, which is also called omphalocele. Here you have herniation. In omphalocele, we have herniation of the abdominal viscus through the umbilical cord. Is it clear? So that is omphalocele. It is different from gastroschisis, which is an abdominal wall defect where the abdominal wall fails to close. Here in omphalocele, it is a herniation of the abdominal content through the umbilical cord. Now, the next definition is going to be disruption. So what is disruption? A disruption defect implies that there is destruction of a part of fetus that had initially developed normally. Is it clear? So disruption defect implies that there is destruction of a part of a fetus that had initially developed normally. So here in disruption, what do we mean? We mean that a structure has developed completely and then there is a disruption. So that disruption means that what a structure has developed completely and then there is a disturbance of that structure. They say an abnormality of that structure. So example of cases occur in amniotic bands. Is it clear? So here you can see that there are amputation of limbs. So this limb here has developed normally, but you need to know that at certain times there are on the amniotic membranes, there are certain amniotic bands, and this band can adhere to the limbs and amputate these fingers here. So this is why you have amniotic amputation here. Is it clear? And you can also have amniotic striae at this level, constriction. This is an amniotic constriction that you can see here. Is it clear? So those are the different things that we visualize. The next one is deformation. So what is deformation? So deformation here, what happens is that what you have is due to an abnormal intrauterine molding giving rise to deformity of structurally normal part. So deformation and disruption are moving quite in the same aspect, because both of them, the structure has already been produced, but then there is an abnormality in there is a deformity. Is it clear? There is an abnormality of the structure of that structure that has been normally formed. But the difference now between disruption and deformation is that the abnormality is different. In disruption, the abnormality can result to a cutting or a constriction, like in amputation and constriction being produced by amniotic band. That's a disruption. But in the case of the deformity, the structural abnormality is that you mostly have a molding, like in the cases of arthrogryposis, or you can have also cases of clubfoot. So arthrogryposis just means that what so this is lower limb deformity. Arthrogryposis just means that you have a contracted joint of a neonate. So that's arthropleposis, contracted joint of a neonate. Or you have clubfoot. Clubfoot characterized by the cave syndrome. C for cavus, A for adductus, V for varus, and E for equinus. Now the next one we have this, which is a dysplasia. So the definition of term dysplasia. Dysplasia refers to an abnormal cellular organization or function within a specific organ or tissue. At least this one I hope you understand. So in dysplasia, what there is an abnormal cellular organization in tissue or organ. And this is an example of dysplasia here, where you have a melanocytic nevus which is accompanied by a smaller congenital nevus. These are smaller congenital nevus here, small congenital nevus, and this is a large melanocytic nevus. Is it clear? So that's a dysplasia. So this is a unilateral terminal transverse defect of the hand occurring associated malformation. Is it clear? So now in this case, now you have classification of birth defects. You can have, so in classification of birth defect, you can have a single system defect. So a single system defect consists of a large group of birth defects that affecting a single organ system or a local region. That's a single system defect. A single system defect affect a single organ system or a local region. So a single system, this is an example of single system defect because only one local region is affected. Is it clear? And this is also an example of a single system defect because only one region is affected. Both hands are affected. There are only one organ, that is the limbs, are affected. That's a single system defect. So you have syndactyly of both limbs, a single system defect. But now the next one is multiple malformation syndromes. So a multiple malformation syndrome is when you have a combination, if you have a combination of congenital abnormalities occurring together repeatedly in consistent pattern which is due to a single underlying cause. So it's termed syndrome. So a syndrome means that there are multiple congenital abnormalities. You have multiple congenital abnormalities with a single underlying cause. So the term syndrome just means running together. So that one is going to be called a multiple malformation syndrome. So a multiple malformation syndrome can be seen in cases, there are different syndromes, like these cases are a child with upper syndrome with bilateral syndactyly occurring in upper syndrome. Just that in this child they didn't show a craniosynostosis because they are saying that this child is also having craniosynostosis, and craniosynostosis means that it's a closed, you have closed frontals. So that's craniosynostosis. Now the next one is sequence. So what's a sequence? A sequence is a term implied that for a series of events occurring after a single initiating abnormality, which may be malformation or deformation or disruption. So sequence just means sequence of events occurring because of one abnormality. Is it clear? One event, sequence of events after a single initiating abnormality. Is it clear? Like example, you have a Porter sequence. So a Porter sequence is a very good example. So a sequence is, you see, that's the difference between a gene and a syndrome and a sequence. Actually, a syndrome are multiple congenital abnormalities with one cause, while a sequence is still a series of events, that means multiple congenital abnormality still with one cause. But the difference between a sequence and a syndrome is that what, for a syndrome the cause usually is genetic, is the gene. Is it clear? So when you have a gene being the cause of the multiple congenital malformations or congenital abnormalities, it is going to be said to be a syndrome. But now for a sequence, usually the cause of a sequence is not gene, but instead a factor which is involved in the newborn growth. Are you getting? A factor which is involved in the birth of a newborn is going to result to a sequence and not a syndrome. Example, if there is a certain molecule which is used in the growth of the newborn and that molecule is not present, while the gene of the normal production of those organs are present, that one is going to be called a sequence. The another example, if an organ is required for the production of other organs inside the unit, and that first organ is not produced, is going to result to a sequence. So let's take an example. An example is going to be Bopda sequence. So what is Bopda sequence? Bopda sequence is multiple facial abnormalities, limb abnormalities, which arises and oligohydramnios. So it's multiple facial abnormalities, limb abnormalities, and oligohydramnios, which arises from bilateral renal agenesis. Is it clear? That's the Bopda sequence. So we have multiple limb abnormalities, facial abnormalities, and oligohydramnios, which arises from a renal agenesis. So abnormal, that is the kidney has not grown. Since the kidney has not grown, what happened is that there is no amniotic fluid, and amniotic fluid is required for skeletal formation. So now the next one, we have association. So certain malformation occur together more than expected. So those are what they are called association. So normally malformation which are in different systems, these are certain malformation which occur in similar patterns, but there is no common cause together. They are called association. Malformation occur together often than expected, but they don't have a particular genetic cause associating them. It's called association. Is it clear? So what is an example of association? We have Vata association. Vata association consists of vertebral abnormalities, anal atresia, tracheoesophageal fistula, and radial defect. We also have Vactal association. It's a greater aspect of Vata association. So we have vertebral abnormality, you have anal atresia, you have C for congenital cardiac abnormality, congenital heart disease. And so you have T for tracheoesophageal fistula, R for renal disorders, and L for limb defects. Now the next one is milk association. So milk association is given because of non-random occurrence of Mullerian duct aplasia, M for Mullerian duct aplasia, MU for Mullerian duct aplasia, R for renal aplasia, and C for cervicothoracic somite dysplasia. So those are the three main things involved in milk association: Mullerian duct association aplasia, renal aplasia, and cervicothoracic somite dysplasia are the three things. So the next one is charge association. Charge association is related. So here you have colobomas of the eye, you have heart defect, you have corneal atresia, you have mental retardation, and you have growth retardation with ears abnormalities. So these are the different associations that you have. The next one are complexes. So this is an external ear malformation pre-ocularly, the golden hair syndrome. So I'm not going to speak about the next one. The next one is the complex. Complex is the term developmental field complex has been used to describe abnormalities that occur in adjacent or related structures from defect. So when you have structures at the geographical location having abnormalities, they are said to be complexes. Is it clear? So you have complexes when you have geographical structures which are being affected. Like example, we have the golden hair syndrome, you have the Poland anomaly, and you have the Mobius syndrome. All these syndromes are more of complexes than syndromes. So the golden hair syndrome, you see that one, you have the geographical structure is that you have external ear abnormalities with location at one point. Also, you have a form of anal atresia which are complexes, because sometimes you have anal atresia plus vaginal atresia plus urethral atresia. Is it clear? So when you have all this in a particular geographical location, it's more of of complexes. So Gardner syndrome is a hemifascial microzonia. You have polar anomaly and all that. So those are complexes. In polar anomaly, you have the ribs and the skeletal muscles, the ribs and the clavicles at the level of the axial skeleton are not produced they are not produced large enough. So that's why you have complexes. So identification of syndromes. So what is it? Why did it happen? What does it imply on my child future, and will it happen again? These are the questions that the parents are going to ask you, and you need to answer when you identify a particular syndrome. So this is an example of the diagnosis of Lang syndrome, which is based on the characteristic facial features associated with growth failure and developmental delay. This is Williams syndrome associated with facial appearance, developmental delay, cardiac abnormalities, and this is extremity laxation in Ehlers-Danlos syndrome. Ehlers-Danlos syndrome is associated with collagen disorders. When you have a collagen 1 fiber disorder and collagen 2 fiber disorder, and collagen 3 fiber disorder, which is used in the production of collagen 1, is Ehlers-Danlos syndrome. You are going to have hyperelasticity of joints. So these are the different cases. So this is lobulated tongue in case of orofacial syndrome type 1 is an X-linked dominant disorder. Then here you are going to have hand and both abnormalities with sympodactyly due to autosomal dominant mutation of the HOXD13. Now stillbirth. Stillbirth is just, what is the definition of stillbirth? Stillbirth is defined as dirt after viability. So in utero dirt of a fetus after viability, and viability depends on country. Like in our context, viability is going to be 28 weeks of gestation in Cameroon. But in other countries, like in European countries, viability can go at 22 weeks of gestation, and in USA it can go up to 20 weeks of gestation. Is it clear? So stillbirth. Details of examination investigation of malformed fetus and stillbirth is essential if parents are to be accurately counseled after about the cause of the problem. So environmental teratogens. So what are some examples of environmental teratogens? So environmental teratogens can consist of drugs. Is it clear? So we have drugs like, in case of alcohol, drugs like thalidomide, which causes amelia and phecomelias. So it causes amelias, phecomelias, and all that. So we have alcohol, which also causes fetal alcohol syndrome. We have treatment of epilepsy, which causes epileptic medication syndrome. So we have also maternal disorders. So the drugs can be one teratogen. Maternal disorder is another example of a teratogen, like in case of maternal diabetes, any form of diabetes, or you can have phenylketonuria. So diabetes and phenylketonuria are fetal malformation which can occur because of maternal disorders. Is it clear? You have intrauterine infection, mostly the Dutch's infections are involved. So these are examples of teratogens. So drugs, you have alcohol, anticonvulsant, phenytoin, sodium valproate, carbamazepine, anticoagulant, warfarin, antibiotics, streptomycin, even tetracycline, treatment of acne, tetracycline, isotretinoin. So all these are drugs. Now for environmental chemicals, you have mercury, you have organic solvents, you have also ionization radiations, ionic radiation. So this radiation, that's why we don't like to prescribe X-rays, and also we don't like to prescribe CT scans to women that are giving birth, except we can prescribe a CT scan at the level of the third trimester in order for you to have a radiologic, if you want to have a radiologic pelvimetry, a radiologic pelvimetry in order to diagnose a contracted pelvis. You can prescribe it at third trimester. Why? Because by third trimester the child is already is already big enough, and then they cannot be those mutations that may occur and result with disturbance. Mutation usually occur by the level of the first and second trimester when there is still organogenesis, but when the third trimester is already formed and the end of the second trimester has already occurred, organogenesis has already occurred, so there is less risk of mutation. Maternal disorders in cases like epilepsy, diabetes, phenylketonuria, hyperpyrexia, iodine deficiency can result to disorders. And the next one is intrauterine infections like torches infection like toxoplasmosis, others like varicella, R for rubella, C for cytomegalo, H for herpes simplex, and then S for syphilis, and E for Epstein-Barr viruses. So from here we are finished with all the diseases and the dysmorphologic and teratogenic diseases in genetics. Thanks for your kind attention. Don't forget to like and subscribe for our channel. Thanks very much.